Last year, more than 1.2 million people in the United States were diagnosed with some form of cancer. More than 1/2 million people died from the disease. That's 1 per minute. Among women, breast cancer is the most commonly diagnosed form. It is also the third leading cause of all cancer deaths. However, depending on the stage of the cancer at diagnosis, 21 to 86% of women who develop breast cancer will survive for more than 5 years with conventional treatment. Cancer can begin in many ways. One way is by a free radical damaging a portion of a cell's DNA, the body's genetic code. Even though we each have an elaborate system to fix this kind of damage, there is a chance our body can't make an exact repair. If a misrepair happens to a section of DNA involved in a cell's growth, the cell may become cancerous. That is, the abnormal cell may begin to divide uncontrollably and spread throughout the organ and possibly to other areas of the body. As the tumor grows, it pushes neighboring normal cells out of the way. It also initiates vascular growth to provide a blood supply to the rapidly growing mass. When it grows large enough, the tumor can be felt through the skin, and in worst-case scenarios, it may even grow to the edge of the skin and create a surface lesion. As Paw Paw's active components are absorbed into the bloodstream, they travel to the cancerous tissue. The operative compounds are absorbed into the cells and make their way into the inner workings of the cell. Once inside the cells, these compounds seek out the mitochondria of the cell. All cells, especially cancer cells, need energy to grow and divide, and most of the energy cells use is produced by the mitochondria. Along the inner membrane of the mitochondria are collections of 5 complexes that are responsible for converting molecules from the food we eat into a form of energy that cells can use. Each trip through these complexes produces a molecule called ATP, or adenosine triphosphate, which provides the energy necessary for nearly all cellular functions. Resistant cancer cells have a built-in protection mechanism, a pump in their cell membrane that pushes chemotherapeutic drugs and other toxins out of the cell. Since the pump requires ATP energy, when Paw Paw blocks production of ATP, the chemotherapeutic drugs remain in the cancer cells longer. This makes Paw Paw an excellent adjunct for chemotherapy. Once the Paw Paw compounds enter the mitochondria, they attach to the first complex and block the chain reaction, slowing or stopping the production of ATP. Heavily dependent on energy from the mitochondria, the cancer cells are essentially starved when the production of ATP is blocked. The weakened cells begin a process of programmed cell death. Since ATP is also required for the production of new blood vessels to feed cancer cells, the tumor's blood supply also begins to disappear, further hastening the tumor's death. Together, this may lead to a reduction in tumor size and hopefully an eventual disappearance of cancerous cells. In chemotherapy, the drugs that prevent growth or kill abnormal cells can also harm and often kill healthy cells. Although cancer cells grow faster than healthy cells and are therefore affected to a greater extent, chemotherapy is harmful to both cancerous and healthy cells.